بسم الله الرحمن الرحيم. الحمد لله والصلاة والسلام على رسول الله وعلى آله وصحبه وسلم أجمعين. اللهم انفعني بما علمتني وعلمني بما ينفعني وزدني علما إنك العليم الحكيم. اللهم اخرجنا من ظلمات الوهم وأكرمنا بنور الفهم وافتح علينا بمعرفة العلم وسهل أخلاقنا بالحلم. اللهم ارزقني نعمة الإخلاص لوجهك الكريم بكل ما أقول وبكل ما أفعل. آمين يا رب العالمين. My topic today is about acute cholecystitis, and here we will talk about also acalculous cholecystitis. Acalculous cholecystitis is inflammation of the gallbladder without gallstones, and present in about 5% of cases of cholecystitis. Untreated acalculous cholecystitis progresses rapidly and has high risk of mortality. What are the predisposing factors for acalculous cholecystitis? Include diabetes, malignancy, burn injury, recent surgery or trauma, cardiac disease, positive pressure ventilation, and total parenteral nutrition. What are the clinical presentation? The clinical presentation may differ from that calculus cholecystitis in that the severity of the disease may be out of proportion of the severity of the right upper quadrant pain. Some patients are pain-free despite of leukocytosis and fever. Here, a patient with cholecystitis, as we see in this patient, we have thickened gallbladder, and we have also pericholecystic fluid and stranding edematous of the fat and some distension of the gallbladder, and we have no gallstones noted. As we see here, the wall is enhancing. In some area, the wall is not enhancing. And here the wall is enhancing, and here we see dense area of the sloughed wall in the lumen of the gallbladder, and indicating that patient has acute acalculous cholecystitis and with sloughing of the wall in the lumen of the gallbladder and consistent with gangrenous cholecystitis. The acalculous cholecystitis or calculous cholecystitis also can be gangrenous or can be emphysematous. The gangrenous type of cholecystitis can be with calculus or without calculus, and it is with advanced age, with secondary ischemic necrosis, and we should look for a slough of the gallbladder wall in the lumen of the patient. And here, as we see here, there is a sloughed wall and there is no wall in some areas, as we see also here. Emphysematous cholecystitis also occur with calculus or with acalculous cholecystitis, and it is due to infection usually with bacteria, most commonly with Escherichia coli or Klebsiella, and 50% of cases have diabetes, and they have characteristic intramural gas. Thank you for listening and hoping to see you soon in another talk.